Thank you, everybody. I don't know about you. I came in around 9:30, but this has been a really, really informative, really great exchange of information. So let's give Komen a round of applause for this. I certainly am going to take some of the learnings that I had today back to Pfizer, because we're always trying to revamp our presentations and our outreach to the public. So my name is Melissa Bishop Murphy. I work in government relations for Pfizer. I co-lead what's called the Multicultural Center of Excellence. And so I go around the country talking to minority groups, working with minority groups on issues that are important to them. And disparities in cancer care is one of the major issues that I hear a lot from the grassroots advocates. So this presentation is one to really talk about diversity in clinical trials. But I think a lot has already been said by the previous speakers, so I'm not going to spend a lot of time on my first couple of slides. Let me see. We already know, given the information that has been shared from previous speakers, that African American women are getting breast cancer younger, and they're getting a more aggressive form of cancer. So I won't spend any time on this slide. And we know, again, that African Americans and other minority women are not participating in clinical trials. That's why I kept asking all those questions, because I was just hopeful at some point we were going to have some new information, because I have Pfizer information, but I would love wanted to, with fingers crossed and breath held, hoping that minority women were involved more, and we are not. I say we because I am an African American woman, and it just hurts me really personally that we aren't involved in clinical trials as much. But to see your slide where the women said, if I can't help myself, I definitely want to help the future generation. And when talking to women across the country, that's what I'm hearing from minority women. They are saying, if you ask me to be in the clinical trials, I will participate in the clinical trials more often than not. So we need to make sure that we have diversity in clinical trial participation. And why is it important? I mean, we've seen it in the data. To hear about the positive tumors, that there are differences, even if you are diagnosed with the liminal tumor, you can still have negative results. That's the reason why. That's the precision or personalized medicine that we as a pharmaceutical company and others who are doing research in this area, we need those diverse participants so that we can address those differences. Not everyone is the same. So one of the reasons definitely is so that we can start customizing the medicines based on race in particular in this instance. And as we saw, we are seeing differences in the outcomes even when there is a treatment for that particular types of cancers. So that's another reason why. But I think I'm probably preaching to the choir today that you all agree that there needs to be diversity in clinical trials. So how do we obtain, do we do diversity in clinical trials? I find that it's really a grassroots effort. It is of course the physician asking the patient, will he or she participate in the clinical trials? But I think it's what I've heard from advocates across the country. It is also talking to those grassroots advocates like the churches, like sororities and fraternities. To reach out to minority patients, it really has to be on the grassroots level. And so we at Pfizer have reached out to the National Black Nurses Association, the National Hispanic Nurses Association, the National Medical Association, the National Hispanic Medical Associations in particular, to help us to increase diversity in our clinical trials, because those are what we call the trust barons in the African American and Hispanic communities. There is a lot of distrust, reasonably so, given what has taken place in the past around clinical trials. And we cannot hide from that fact that when it came to clinical trials, minorities were not treated well, and we can't run from Tuskegee in particular. So we need those trust barons in the community to almost bless the fact that there's this clinical trial taking place, and we want you to be a part of that so that we can have medicines that will be effective with your type of tumor. What we've found in particular, and I hope there are patient navigators in this room, but that the patient navigation program has been very successful in increasing diversity in clinical trials. So we really, in particular, there was a patient navigation program done by Dr. Friedman at the Dr. Friedman Ralph Lauren Cancer Center that has been sort of the model in terms of increasing diversity in clinical trials. And so I would urge you, if you don't know about it, please feel free to outreach to me. I have a colleague here as well who lives in the area to get additional information about that patient navigation and how that can help with increasing diversity in clinical trials. There's also a really great navigation program at George Washington University. And there are tools out there for cancer centers to initiate patient navigation programs to help increase diversity in clinical trials. So what has Pfizer been doing? I sort of mentioned it already, but we also have been working with the Sisters Network, Sisters by Choice in particular, but there are our network of African American breast cancer survivors that, if you're not familiar with this network, across the country. And they really are targeted to minority and African American women. And so we've been working with them also to, because they are a trusted source as well in the community, working with them to encourage their members to participate in clinical trials. I really like this grassroots initiative, really, that Your Metastatic Breast Cancer Initiative. I'm going to steal it and tell all the groups about it and all of that. Yeah. And we also have been working with Susan G. Komen. We did a Komen, they have a Komen Health Equity Initiative. I don't know if you're aware of that, but Pfizer has been a partner with that. And we did roundtables all over the country targeting African American women, saying, why aren't you participating in clinical trials? What are the barriers to access? What can we do to help you to get more engaged? And there were readouts from Atlanta, Houston, Philadelphia, and I think you can find that on you all's website, but if you can't, I have those readouts from those roundtable discussions, and some of that information may be applicable to Boston. So definitely, if you're interested in that, reach out to me or to Komen as well. And one of the really great things is that we know that people are living longer with breast cancer, and they're going back to work. And so how does the employer work with a person living with cancer? So we've been working with the Cancers and Careers program to figure out what does good look like in the workplace. A lot of the women who live with breast cancer have to work. You saw Dr. Warner's presentation in regards to, as you lose income, your results of living with cancer goes down. So we want to keep these women working if they want to do that. And so Cancer and Careers has some really great information. So if there are employers who want information about that, we can get that information to them as well. And then we also are working with the National Medical Association, which is the African American Medical Association, having regional discussions. In fact, we'll be in Philly the last week in July, going into the first week in August, and there will be a big session on breast cancer led by Dr. Edith Mitchell who is the immediate past president of the National Medical Association that we'll be participating in. So we're trying to do our part, but there's so much yet to be done. So we need all of you to be active and engaged. And there's some ways that you can be active and engaged, especially around policy initiatives. Again, you heard Dr. Warner talk about the social economic issue when it comes to care and treatment and living longer. And so there's a program, it's a federal law, in fact, called the National Breast and Cervical Cancer Early Detection Program. And it also pays for treatment under the Breast and Cervical Cancer Prevention and Treatment Act. And this is a federal law. But what we've seen in most states, that these two programs are severely underfunded. And so as we talk about the need for access to care, I would urge all of you to consider supporting in your state increased funding for these programs, because that will go a long way, we believe, in helping with healthcare, improving healthcare disparities. Again, it's an important program to improve health equity. You can see the statistics, we've heard about it. It also provides patient navigation and case management services. So I don't know if are you guys familiar with this piece of legislation? Some of you are. I see some heads. That's great. Again, more information about the program. It improves access to screening and treatment. In particular, Pfizer is working on increasing funding in several states. So we have a state advocacy initiative in 8 states this year to increase funding. These were states we identified that really needed to increase their funding for these programs: Kansas, Missouri, Michigan, Ohio, Washington, Florida, Virginia, and Texas. But I'm sure, like any federal or state program, is always the first on the cutting block when it comes to a balancing budget. So please check your state out to make sure that your program is adequately funded. So we can't leave this presentation without a call to action, because again, the way to increase African American and other minority participation in clinical trials is to activate. And so how do you activate? Well, you first need to understand the disparities in breast cancer. And I think we got a great understanding this morning from the various speakers. You need to be knowledgeable of the clinical trials, diversity, inclusion, and locating them. So clinicaltrials.gov is a good source to find out where the clinical trials are taking place. When I talk to minority groups, they really talk about informed consent. Really understanding. You saw that women stopped taking their medicines because they just didn't understand. So having the knowledge and communicating the knowledge to that person living with breast cancer is very important. Then in terms of getting them to sign up for clinical trials, we definitely want them to have informed consent. And then if you're a healthcare provider, I really think it does start with the healthcare provider, Dr. Warner. I think you made a really important point that they really need to be culturally competent, culturally sensitive to the patient. I live in Atlanta but work nationally, but even in Atlanta, which when you think about the wages there in terms of the African American population is one of the more affluent areas in the country. But I've talked to women who've had insurance, who had many degrees, and they too have said, well, my doctor said it was my choice. And I'm almost flabbergasted when I hear that they take the watchful waiting approach a lot of the times with their breast cancer, and so that when they do go back, it's metastatic breast cancer. So we really do need to start with the providers and educating them to be culturally competent in their discussions with the minority patient. And we need to also introduce them to the referral networks across the region and support and provide information to their patients on clinical trial participations. We're trying to come up with more documents that we can leave at the doctor's offices that talk about informed consent, clinical trial participation. So we're trying to develop those pieces, and I know other companies are as well. As we get them, we'll share them with all of you. So that concludes my presentation. I'm open for questions. These are some questions that we talked about. I told you we worked with Komen last year, but these were some of the questions that we discussed when it came to clinical trial participation. This seems to be the ones that are most important to the community. So anyway, I'm going to stop here and we can do questions. Thanks.